going to be presenting our work, Perceptions of 30-Day Postoperative Function Compared to Quantified Performance, Factors Affecting Perceived Functional Decline in Patients Aged 80 Years and Older. Surgical outcomes in the older adult patient population are largely measured using traditional outcomes such as morbidity and mortality. However, there is a need for patient-reported outcomes, or PROs, to be included to improve surgical quality and better understand the patient experience of surgery for these patients. We used a new variable, perceived physical function at 30 days postoperatively, and assessed whether the perceptions of physical function correlate with quantified function as measured by ADLs. Additionally, we aim to identify factors associated with perceived functional decline in these patients at 30 days post-op. For this study, we used ACS NSQIP geriatric surgery pilot data from June 1, 2015 to December 31, 2019. Included patients were aged 80 years and older. Outcomes that we looked at were perceived physical function, or PPF, and whether this was diminished, similar, or improved from prior to surgery as reported by the patient 30 days postoperatively. Additionally, we looked at quantified functional decline, which is the difference between preoperative and postoperative performance on ADLs. Covariates were baseline patient factors, surgical factors, and older adult-specific factors, such as delirium. We looked at chi-square and multivariable logistic regression to perform our analysis. Concordance between perceived physical function and quantified function were calculated with the kappa statistic. This study included 5,464 patients across 16 hospitals. 32.7% had a decline in their PPF, and 27.5% had a quantitative functional decline. The kappa was 0.25. 1/5 of patients without functional decline in their ADLs or quantified functional decline reported a worsened perception of their functional status. Associations with worsened perception of functional status were age over 80, each year was a 3% increase in odds, ASA class of 4 or 5, disseminated cancer, emergent surgery, undergoing orthopedic surgery, preoperative malnutrition, fall history, and postoperative delirium. In conclusion, from this study, there demonstrated discordance between what patients are perceiving in terms of their functional status postoperatively and what clinicians are measuring for surgical outcomes. There are patient, surgical, and older adult-specific factors that are associated with a decreased PPF. There's opportunity to possibly target these patients with these risk factors for improved goals of care discussions and what to expect after surgery in the postoperative course. This study gave us insight into adverse patient experience following surgery, and there's a need for some older adult-specific patient-reported outcome measures to fill in the gaps between what patients are perceiving after surgery and what their clinicians are seeing. Thank you.